I'm thankful to welcome you to what appears to be the beginning of the end of the longest government shutdown in U.S. history.
Optimism today on Capitol Hill as there is bipartisan agreement to sign on to a continuing resolution to fund the government. I talked to Senator Bill Cassidy about this and the ongoing effects of this government shutdown on Louisiana citizens. He says it's time for the shutdown to end as the human toll continues to rise.
Republicans were willing to negotiate, and they said, no, we don't want to negotiate. We're going to shut down. 40 days later, we got all those consequences.
Consequences such as SNAP benefits not being fully funded, which affects 18% of the state population.
300,000 children, I'm told, in Louisiana.
It also affects people in the process of trying to buy flood insurance as the National Flood Insurance Program has not been operational, something they may need to purchase that new home.
That program was shut down because the government was shut down. You've had to delay for 40 days something that you've been kind of pointing towards.
Not to mention federal workers not getting a paycheck.
If you are in the military, Border Patrol, if you are taking care of prisoners at one of the facilities in Oakdale or an air traffic controller, you weren't getting paid.
The amended CR will likely pass the Senate, but also has to go through the House of Representatives and be voted on there.
I will call all House members to return to Washington as quickly as possible. We'll give a 36-hour formal and official notice so that we can vote as soon as possible to pass the amended CR bill and get it to the president's desk.
7 Democrats agreed to vote with Republicans to get the CR through the Senate, but not all Democrats are in agreement. The CR does not extend Obamacare subsidies, a main item the Democrats have advocated and fought for.
I cannot support the Republican bill that's on the floor because it fails to do anything of substance to fix America's health care crisis.
Senator Cassidy believes the government needs to open first, and then Republicans will negotiate, as he says Republicans want to lower the cost of health care as well. He says the Republican plan is to empower the patient instead of the insurance companies.
Give the power to the patient, not the money to the insurance company. If we do that, we can keep the cost of having health insurance lower and begin to lower healthcare costs, not just for those on the Obamacare exchanges, but for everybody.
Senator Cassidy is optimistic about the bill's chances in the House and is confident it will make it to the finish line.
I'm optimistic they will pass it Wednesday. The president will sign it Wednesday. The government will be open.